Welcome to Health Bulletin. In our Medical Myths series, we bring expert insight and thoroughly reviewed research to separate fact from fiction about lung cancer. Among a range of misunderstandings and mistruths, we explore the myths linked to pollution and also debunk the myths surrounding surgery and other risk factors. According to the Centers for Disease Control and Prevention in 2018, there were 218 of 520 new cases of lung cancer and 142,080 related deaths in the United States. Globally, in 2020, lung cancer was the second most common cancer after breast cancer. With 221 million cases, it was responsible for 1.8 million deaths. Although prevalent, lung cancer is commonly misunderstood. Myth number 1, only smokers develop lung cancer. Well, that is not correct, and unfortunately, it's a very hurtful myth and causes stigma. According to the CDC, around 10 to 20% of people with lung cancer in the US never smoked, or have smoked fewer than 100 cigarettes in their lives. According to the CDC, every year around 7,300 deaths from lung cancer among non-smokers are from secondhand smoke, and a further 2,900 are from radon exposure. Myth number 2, there is no way to reduce the risk. Absolutely wrong. There are several ways to reduce lung cancer risk. First and foremost is smoking prevention and smoking cessation. For anyone who is trying to give up smoking, here are some evidence-based tips to help in the description. Limiting exposure to secondhand smoke, which is sometimes called passive smoking. According to the CDC, non-smokers who are exposed to secondhand smoke at home or at work increase their risk of developing lung cancer by 20–30%. Other risk factors include radon exposure. Thus, measuring radon in your home is important. Also, certain lifestyle behaviors are considered potential risk factors, and regular physical exercise and avoiding obesity is important. Myth number 3, only older adults develop lung cancer. No, that is also not true. Although more than half of people diagnosed with lung cancer are older than 65, more and more younger individuals below the age of 50 are getting lung cancer, particularly women. Myth number 4, living in a polluted city is worse than smoking for lung cancer risk. There is good evidence that pollution generated by traffic increases the risk of lung cancer. Exposure to nitrogen dioxide, nitrogen oxide, sulfur dioxide, and fine particulate matter were positively associated with the risk of lung cancer. Occupational exposure to air pollution among professional drivers significantly increased the incidence and mortality of lung cancer. However, comparisons between pollution and smoking are harder to make. Living in polluted cities is a risk factor, but no one knows for sure whether it is worse than the use of tobacco products, and the combination might be even worse. Myth number 5, I've smoked for years, there's no point stopping now. But experts say smoking cessation reduces the risk of lung cancer significantly. Aside from lung cancer, stopping smoking, it also reduces the risk of developing a range of other conditions, including heart disease, osteoporosis, and diabetes. Myth number 6, smoking cannabis does not increase lung cancer risk. We believe cannabis represents a risk factor, but we need more long-term studies. Although epidemiological evidence for an association between cannabis and lung cancer is limited and conflicting, one of the difficulties in studying this association is that people who smoke cannabis often smoke tobacco too. This makes teasing apart the effects of each factor more challenging. Myth number 7, if you have lung cancer, you may as well continue to smoke. This is not true. Alongside the myriad benefits of quitting smoking, people with lung cancer who quit smoking have a better prognosis. Myth number 8, lung cancer surgery makes the cancer spread. No, lung cancer surgery does not make lung cancer spread. In fact, lung cancer surgery is advised only in early stage of lung cancer, because at this stage, it can cure the cancer. If a tumor is large or has loco-regional dissemination, then alternative therapy, such as chemotherapy or immunotherapy given before surgery, will further reduce risk of having cancer cells in the blood. Clinical research has shown that this approach prolongs survival and reduces the risk of dying. Myth number 9, if I had lung cancer, I would have symptoms. Unfortunately, that is not always the case. Lung cancer can be detected in totally asymptomatic cases, or in individuals with slight respiratory symptoms. This is one reason why lung cancer screening in high-risk people is so important. Also that even in non-smokers, there may be an advantage to screening, but studies have not confirmed this yet. Studies with lung cancer screening in never smokers are ongoing, reiterating that catching lung cancer early increases survival rates. Myth number 10. Lung cancer is always terminal. Thankfully, this is also false. When healthcare professionals detect lung cancer early, it has a cure rate of more than 60%. Even lung cancer diagnosed in more advanced disease today has a much better prognosis for long-term survival in certain types of lungs KA. There have been lots of progress in therapy and outcomes for patients with advanced lung cancer too, that has specific genetic mutations which can be targeted by specific therapies has been tremendous over the last decade. Myth number 11. Antioxidant supplements protect against lung cancer because antioxidants play an important role in protecting our cells from DNA damage that could include cancer-causing mutations or other genomic abnormalities. Several clinical studies have been performed, but unfortunately, most failed to demonstrate any conclusive protection against lung cancer in a clinical setting. There are a few studies indicating that several dietary antioxidants, like carotenoids and vitamin C, may protect against lung cancer, but the results overall are somewhat ambiguous. More specific studies in well-defined smoking populations are needed, as well as studies of dosages of antioxidants. Myth number 12. Smoking is the only risk factor for lung cancer. Smoking is perhaps the most well-known risk factor for lung cancer, but it is certainly not the only one. Other risk factors include a family history of lung cancer, exposure to air pollution, exposure to radon, exposure to asbestos, previous radiation to the chest, and chronic lung disease. Thanks for watching, and if you enjoyed this video, make sure to subscribe to our channel for more valuable content.